Hey guys, it's Dr. Adam with A Sip of Aesthetics, your new favorite podcast, and we are here with Lauren today.
Hello.
How
Thanks
are
for
you
having
doing?
me back. I'm good. How are you?
Pleasure having you back.
Yeah, it's
Um,
great.
we're doing a little bit of a different thing today. We're doing a would you rather kind of
Yes.
theme, I guess. So
I'm gonna ask you some questions, and then you're gonna answer
perfect.
to the best of your ability and answer truthfully. Okay?
Yeah, let's see what you have in stores.
Okay. Well, first, how are you?
I'm doing good.
Good.
Good to have you back.
I know. I love being here.
Thank you. Yeah, and for all of the listeners, let us know kind of if you have any suggestions or anything else you want to talk about. You want us to talk about. But this is gonna be, I guess, all kind of different topics, and we're still gonna try to be informative. We're gonna
But fun.
sneak in some facts there. Yeah, absolutely.
Would you rather try a new experimental treatment with no guarantee of results, or stick with your favorite well-known treatment?
I have to pick one. I kind of want to do both.
You want to do both?
I mean, that I think will depend on who you're asking. Some people are kind of like more of a cowboy. They want to try the new treatments. Versus other people, they just want to kind of stick to that what's safe and true. But that's a relevant question, because sometimes there are treatments that we do here that are pretty well known. There's always like the new treatment, the new technology.
I think I would probably do the well-known treatment. I don't really like to. I
Yeah.
feel scared.
Well, I mean, if it's to do the same, if you're trying to do, like get rid of some lines and we know Botox works or
Yeah.
something
Oh,
for it,
that's true.
why try a new treatment?
No,
But if
that's
it's
true.
something like completely different,
Okay. No, I like that. That's true.
wouldn't you want to
I
try
like
it?
that. Okay. 3. Would you rather have a treatment that lasts for a year but is painful, or one that is painless but only lasts 1 month? That's easy.
Well, which one would you do?
I would do the painful one, but I would just numb
Yeah.
for like.
Well, no, you can't numb.
Yeah.
That's the whole point.
No. Yes, you can. What do you
No,
mean?
you can't numb. Okay,
No.
I'm asking the question now. Would you?
No, it's true. Have it
Well, that's
last
the
1
point
year,
then. Okay, but you numb.
but it's painful, but it's gonna last 1 year, or it lasts for what, a month, but
A month.
it's painless. A year.
Yeah, I would go.
Because
with
then you
the
would have to
year.
continuously keep
Well,
doing
it
it.
depends on how painful it is.
Okay, all right. Would you rather get free treatments for 1 year, but have to wear a ridiculous outfit every time you visit, or pay full price, but get to wear whatever you want?
For a full year, I have to wear a ridiculous outfit, or
Yes.
only when I'm doing the treatment?
For a full year. When you're doing the
Oh
treatment, you
man,
have to come
I
in with
get
a
free
ridiculous
treatments
outfit.
anyways. Why? Because
I
I
know,
do the
but-
treatments.
Okay, so but what would you say?
I mean, wear a ridiculous outfit, stand
Yeah.
out, be something different, be
Okay, and
yourself.
what treatment would you get?
All of them.
But
I'm
what's
wearing
like
something
your-
ridiculous.
What's your favorite treatment?
I mean, I love Botox. I do Botox all the time, neuromodulators all the time,
Okay.
and lasers and such.
Okay.
What would you like wear?
I would probably do lasers,
Okay,
and I would wear this because this is a ridiculous outfit.
to start with.
Exactly. And then what treatments? What treatments do you get done?
Well, I mean, Botox that I've mentioned, or like neuromodulators in general, just to kind of keep the wrinkles away. And just, we lose collagen as we age, so I like to keep up with that. So I like to do treatments that are going to help rejuvenate and just kind of help our bodies produce that collagen that we're losing. So I like things like radiofrequency microneedling is one treatment I really like. And then just kind of like there's some lasers, like I like the pico laser, just to kind of again keep up your skin tone and skin texture.
Do you keep up your skin care?
Yeah, although I sometimes
With your
forget.
sunscreen and
Yeah,
everything?
yeah, I should be better at that. I'm not super compliant, but do as I say, not as I do. You should
Good.
always wear your sunscreen.
So see, men can do things too. It's not just
For
ladies
sure.
that can. I think also there's a lot of men out there that want to do treatment, but they don't want to because they're scared or they're nervous and they don't know where to start. So maybe what's one thing that they can start doing just to ease into it?
We're seeing a lot more men, come in and stuff, and it really varies from person to person. But a lot of times people, when they think, okay, we're coming to a med spa, it has to be this huge transformation where they're going to come out with looking like a completely different person. But there's obviously things that are a lot more gentle, a lot more preventative that you can do, and a lot of times men will start with things like that. I mean, a little bit of neurotoxin in the face, again, just to smoothen out wrinkles, very popular. But even things like laser and things like that, just to improve the texture, the quality of the skin, get rid of some of the fine lines that
Okay.
we see in the skin. So
Great.
that's a
I
good
love that.
place to start.
Okay, so if you were speaking to somebody's wife or someone that's trying to get a gift certificate for their husband or their boyfriend, where should they start?
I love Botox, and
Mhm.
it's like a lot of men they come in and it's their first time, and
And
they're
they're
kind of like, yeah, they're scared,
Yes.
like, I don't want to do this and stuff. But honestly, most of the time we do it, and
They
then
love
like
it.
3 months, like clockwork,
Yes.
they're back. They're like, let's do it again. I love it. It was great. So,
Can you tell my husband that?
yeah, for sure, bring him in. Again, it's just people are men when they do it, because they have this like picture or this idea in their head, and then when they see what it actually is, I mean, you're still gonna look just like you, just like kind of like
It's
less
so simple. It
wrinkles.
refreshes you. It gives you that. Yeah.
If they don't want to do like if they're really against it, a lot of time you can start with like laser, because I see a lot of time men are more okay with like starting out with a laser or something like that, just to help with some of the sun damage. So that might be
Okay.
treatment that most people are going to be okay doing. But if you can get them to try Botox at least for once, most men are actually very happy with the treatment. And the good thing about Botox is you see like the results very quickly, but still it can be very natural, very soft, and so they like it and they enjoy it.
Okay, this is a good one. All right. Would you rather not wash your face for 1 year? Because think
Okay.
about it, not washing your
That
face at
doesn't
all.
sound as
You cannot wash your face at all. So if you're going to the gym and you're sweating, you cannot wash your face.
okay.
Or never get Botox again.
I mean, I would not get Botox again, but I would be very, very sad about that. Can I get like
No.
an alternative, like
No.
Dyspor or
No. So
Xenon?
no Botox. So you wouldn't wash your face. Yeah. See, I would not. Get
Can
Botox
I wipe
again.
my face?
No.
Oh,
You
man.
can't wash it. You can't wipe
It's
it.
getting harder.
Speaking of wash, we're talking about skincare. What is your favorite to use?
Yeah, I should be better about this, because
Yes.
sometimes I just wash it with like water and stuff. But having a good cleanser at home is, I think, really important, because you do want to make sure that you kind of clean up everything in your face.
Yep.
And the good thing about a skincare routine is you can make it kind of as simple or as I don't want to say complicated, but you can make it like pretty simple, or you can have more steps, and it could be more beneficial that way. But there's kind of like 1 or 2 key steps that you should do, and then kind of add on stuff on top of that. So, like
What
I
are
said,
the key steps? Washing your face.
for sure.
Okay.
I think using a cleanser and a moisturizer are going to be very important for
Okay.
most people, and then using a sunscreen if you're going to be outside.
Okay. Love it.
On top of that, there are additional things that can be done, to further target certain things, like whether it's using something like an anti-aging cream, or
Serum,
under
eye
eye
cream.
serum, things like that,
Love
using a toner.
Okay, perfect. And then as far as the time is concerned, so you should be washing what, morning and night?
Yeah,
That's what I
well, it kind of depends what you're using, the type of skin you have. But yeah, at least, morning, and especially if you're wearing makeup and stuff, then you want to wash it off at night for sure too. But it will depend on your skin type, what kind of cleanser you're using, if you have oily skin, dry skin, that kind of stuff for sure.
Perfect. All right.
Don't use, usually you don't want to use very hot water, so kind of like warm or cool water is usually good for the skin for most people.
Exfoliation too is important.
Yeah, exfoliate kind of as needed. Doesn't have to be every day, but
Okay.
maybe a couple times a week.
Perfect. I love that.
Awesome.
Okay, this is a good one. Would you rather prioritize treatments with immediate results or those with long-term benefits?
I like the long-term benefits
Me
one.
too.
I like that sometimes, and that is something that actually we do have to, when you're getting treatment, you have to kind of choose. There are treatments where you kind of see more of an immediate result, but maybe they don't last as much.
Okay.
There are other treatments where you kind of get a longer duration, but you have to be a little bit more patient to see results. Like things that are going to promote collagen. There are a lot of treatments that can promote collagen, but because it just takes your body time to produce that collagen and kind of rearrange it and put it in the skin. Usually these types of treatments will take sometimes multiple treatments depending on the exact modality, and it will take some time to see the results, but you end up I love these kind of treatments because I think for long term, for kind of just keeping
More
your
benefits.
skin exactly.
No, you're right. I love Botox and fillers like the rest of us, but I think that a good laser treatment it goes far, or RF or something like that. That's going to be, obviously it's going to take a little bit more for you to see results, but the long-term benefits of that overpower, I think.
And at the end of the day, it's like there's honestly a place for everything. I mean, these are all tools that we have within our toolbox. Everybody's needs are going to be different.
Yes.
And then sometimes people are going to have different time frames. Like they want to look great for next week because there's an event or something like that. And there are some things that, like Botox that works, pretty quickly and still amazing. It's like, probably the treatment I get done the most. So it's not like one or the other, but I do believe that the long-term treatments tend to get overlooked more often. A lot of times you come in and you want that immediate results, but just like a lot of things in life, sometimes the things that are going to be best for us long-term are just going to take a little bit more of time.
Yeah, exactly. Would you rather get resurfix? And for anybody that doesn't know what resurfix is, what is resurfix before I get into the question?
It's a skin rejuvenation treatment that helps, produce.
On a scale of 1 to 10, how gnarly is the pain without numbing?
It's pretty painful. It's painful
Pretty
without numbing.
painful.
If you're gonna ask me if I'd rather get up without numbing,
Yes.
or I wanna hear the or.
Get your lips done.
Ooh, that's a tough one.
Without numbing cream.
I mean, I think I would bite the bullet and get the resurfix done.
I would too, because let me tell you, I don't like tolerate pain very well. So the lip is sensitive to me. So I would rather do resurfix, no numbing cream.
Yeah.
All over my entire body.
Can I cheat and like bring down the settings on the
No,
resurfix?
it has to be cranked up.
Yeah. Well, the thing with lip filler too, lip fillers are very sensitive, but you can use numbing cream. And we can also do like a nerve block, like a dental block kind of thing for the patients who are very sensitive to pain. And then you really won't feel much after the numbing. It's like you don't really feel anything. So you can make it pretty much painless.
And you guys,
with
we have
filler.
that in the office, which is nice.
Yeah, we do that. I think a lot of offices, most offices do offer that. You might have to ask for it because kind of the traditional way is just to use numbing cream. But you can definitely do like lidocaine injections with a lot of offices, and that really helps. But the resurfix is a great treatment.
Yes.
It's pretty painful. I want to ask you a question though.
Yes, please. I'm so nervous. What you're gonna ask me? Go ahead.
Would you rather not be able to get any treatments at all for a year, or not be able to, I don't know, wear any makeup for 1 year?
Oh, I mean, I am a natural beauty, as we know. So I would just not do any treatments. I would not wear any makeup for a year.
Well, if you do the treatments and your skin looks really good, then when it's...
But yeah, I mean, I don't really think I need much. I'm kidding.
I don't
That's
think you
it.
need too much. Well, it's good having you back.
Thank you.
Yeah.
I love being here. When is the next one?
No, we'll have you back shortly for sure.
Good.
But let's continue this conversation in the comment. Let us know what would you rather do out of all the questions that we've talked about, or if you have any other, interesting questions, let us know and we'll tell you which one we would pick. But make sure to like, comment, subscribe, and come back next week for the next episode.
I have so much fun with you. Thank you for having me.
Thank you.
Okay.